FDA is alerting healthcare professionals about rare but serious complications associated with the surgical mesh used to treat pelvic organ prolapse and stress urinary incontinence. The mesh is usually placed transvaginally using minimally invasive techniques.
Over the past 3 years, FDA has received over 1,000 reports of complications. The most frequent included erosion of the mesh through the vaginal epithelium, infection, pain, urinary problems, and recurrence of the prolapse or the incontinence, and their effect on quality of life, including scarring and pain during sexual intercourse. Patients should also be informed that implantation of surgical mesh is permanent and that some complications associated with the mesh may require additional surgery that may or may not correct the problem.
As widely reported, the FDA, Food and Drug Administration, is warning women with pelvic organ prolapse or bladder prolapse, as well as healthcare providers, about serious health complications concerning the use of synthetic transvaginal mesh to treat these conditions.
Hello, I'm Howard Nations. My law firm, the law offices of Howard L. Nations, is a national pharmaceutical litigation firm with clients in all 50 states. And for the last decade, we've specialized in pharmaceutical litigation, suing manufacturers of devices and manufacturers of bad drugs. We're currently engaged in handling the transvaginal mesh cases.
Millions of women in the United States suffer from pelvic organ prolapse, which occurs when the pelvic organs, such as the bladder and urethra, drop downward, often due to a weakness in the vaginal wall, which can be associated with childbirth, hysterectomy, or menopause. When this occurs, it can create pressure on the vagina, pushing it, causing discomfort, and even incontinence. Commonly what is known as stress urinary incontinence, a loss of urine that occurs during physical activity, such as coughing, sneezing, laughing, or exercise. Typically, the procedure used for repairing a pelvic organ prolapse is called an anterior colporrhaphy, where weaknesses in connective tissue or fascia are stitched together. A newer surgery, the transvaginal mesh procedure, involves using a piece of synthetic mesh, which is generally made of polyester or polypropylene. The mesh has what looks like wings called trocar, which are used to anchor it into the connective tissue, where it is sutured into place. In 2010, in the U.S., approximately 75,000 surgeries using transvaginal mesh procedures were performed, which represented 40% of all transvaginal procedures. In an FDA study analyzing organ prolapse patients from 1996 to 2010, it found that those women who received transvaginal mesh to treat this condition were exposed to additional risk compared with those women who were treated with traditional suturing. Both types of procedures, suturing and the use of mesh, according to the FDA, produced similar results. Adverse health effects from the use of transvaginal mesh have been discovered, such as erosion of the mesh through the vaginal tissue, pain, infection, bleeding, pain during intercourse, organ perforation from surgical tools used in the placement procedure, and urinary problems. On October 20th, 2008, the FDA issued a public health notification concerning the high rates of complications with transvaginal mesh procedures. Although the FDA allowed the devices to stay on the market, the agency recommended that physicians obtain specialized training in placing the mesh, that they watch patients carefully for signs of infection or erosion of the fascia around the mesh, and that they fully inform their patients of all potential complications. Quoting William Maisel, MD, Deputy Director, FDA Center for Devices and Radiological Health, the FDA is asking surgeons to carefully consider all other treatment options and to make sure that their patients are fully informed of potential complications from surgical mesh. Mesh is a permanent implant. Complete removal may not be possible and may not result in complete resolution of complications. Reports of adverse events related to the use of the transvaginal mesh have been on the rise in the United States. From 2008 to 2010, there were 1,500 reported cases, a five-fold increase from previous years. This alarming trend caused the FDA on July 13, 2011, to issue an additional warning, a safety communication update. Quote, "The FDA is issuing this update to inform you that serious complications associated with surgical mesh for transvaginal repair of POP are not rare. Recognize that in most cases, POP can be treated successfully without mesh, thus avoiding the risk of mesh-related complications." During testimony before the FDA's Obstetrics and Gynecology Devices panel regarding non-absorbable synthetic surgical mesh for transvaginal repair of pelvic organ prolapse, Public Citizen called for a ban of such products due to high risk of serious complications and no clinically significant benefits from the mesh's use compared to other, safer surgical methods. In this letter, dated August 19, 2011, written to whom it may concern by Dr. Daniel Elliott, Assistant Professor of Urology at the Mayo Clinic, it states, "I strongly support Public Citizen's petition to the Food and Drug Administration to ban the marketing of all currently available non-absorbable surgical mesh products designed and labeled for transvaginal repair of pelvic organ prolapse, and to order all manufacturers to recall such products. I'm fully aware of the complications and their potentially lifelong ramifications. I have come to the conclusion that using mesh for transvaginal repair carries far more risk without any added benefit when compared with the standard surgical approaches without using mesh. I do not hold this view lightly. To quote Dr. William Mayo, founder of the Mayo Clinic, the best interest of the patient is the only interest to be considered." Medical options for treating the symptoms of failed transvaginal mesh are limited, but include surgery. However, as outlined in the FDA's warning, surgical mesh is a permanent implant that may make future surgical repair more challenging. A mesh procedure may put the patient at risk for requiring additional surgery or for the development of new complications. Removal of mesh due to mesh complications may involve multiple surgeries and significantly impair the patient's quality of life. Complete removal of mesh may not be possible and may not result in complete resolution of complications, including pain. Additional treatments for mesh failure include IV therapy, blood transfusions, and drainage of hematomas or abscesses. If you've been treated for organ prolapse with a transvaginal mesh, you likely fall into one of four categories of patients. No present complications. Complications but no surgical intervention. Complications and surgery or surgeries. And complications but surgery is not an option. In any event, you will need representation from an attorney who specializes in this type of complex medical device litigation. A pharmaceutical litigation specialist well known to the defendants, the manufacturers, and their lawyers. Howard Nations is a renowned trial lawyer, recognized as a super lawyer, who has been elected president of national and state trial lawyer associations, lectured to trial lawyers in all 50 states and 12 foreign countries. Mr. Nations has received numerous awards over the decades, the War Horse Award, the Melvin Belli, and Clarence Darrow Awards. Mr. Nations and his staff of attorneys, paralegals, legal assistants, administrators, and trial support work applying experience, expertise, and financial resources to successfully resolve your case. In this type of litigation, known as mass tort litigation, it is not a class action suit, where a group of claimants, sometimes in the thousands or tens of thousands, divide a sum of money. This litigation is what is known as an MDL, multi-district litigation, where all of the cases nationally are consolidated in one federal court, located somewhere in the country. The litigation for the plaintiffs is guided by a plaintiffs' steering committee. In a lawsuit, the plaintiff first proves liability. Who is responsible? In a court of law, that is a costly undertaking, in the hundreds of thousands of dollars. In an MDL, those expenses are shared among all of the plaintiffs, resulting in a low cost to each plaintiff, making a claim even possible. After liability is established, then each case, each individual is considered in terms of damages and the amount to be paid.
We look at your case individually, we pull together your proof individually, we present it individually, we argue it at mediation individually, and we settle your case individually.
Do you have a transvaginal mesh? Are you concerned about complications that you're suffering or might suffer in the future? Our firm offers a free evaluation